So I'm Matt Kavanaugh. I'm the director of the Global Health Policy and Governance Initiative at the O'Neill Institute, which works at the intersection of law, policy, and global health, both kind of focusing here in the US and focusing internationally, and my work is mostly on HIV and infectious disease globally. And as I was thinking about I'm not a China expert, and so I'm really interested to kind of hear what's been talked about here in this room, and also to reflect on what that means in the global architecture, right? That the shift, there is no bigger shift in the kind of world of kind of global health policy than I think the role of China has been over the last few years. And to say, in 2000, 2003, China was one of the biggest initial grantees of the Global Fund to fight AIDS, tuberculosis, and malaria. And in fact, over the first decade of the fund's life, we saw $800 million going to China as a recipient in what was not only one of the kind of most highlighted relationships in global health aid, but also the most politically fraught, right? That in 2011, when the Global Fund suspended funding to China, there was no more high-wire global health financing politics going on than that decision. And it shortly thereafter resulted in China becoming a donor to the fund instead of a recipient of the fund. And so this kind of politics of global health aid has been incredibly important and incredibly fascinating. Today, right, obviously China has actually outstripped the US in the aid game. So as of 2010, the US gives less aid overall than China does, right? And today it's about 7 billion, I was just looking. But what's fascinating, right, is that if you kind of actually track that, and this will be an interesting conversation among colleagues here, if we actually track that, it's a little bit unclear what that means for health. So that I went on to IHME expecting to be able to kind of pull off of it something about China, and we see nothing actually on China as a donor. And so this is my question to both Professor Katz and Professor Cheng. Why not, right? Why don't we see IHME able to track health dollars when it comes to aid in China? Is that likely to change? And if that is likely to change, what does that mean? Does that mean that IHME needs to rethink how it is that they're classifying aid, right? Is it that we can't track health aid because the traditional understandings of it as created by the OECD just don't fit? Or is it that China as an emerging donor is actually going to fit into an existing slot? So I'll leave it there, and I think you go first, Dr. Katz.
All right. So really good questions. I'm going to raise a couple more questions. Okay, so what I want to do today is talk about a project we've been working on that's trying to track the flow of funding in global health security. So the brief outline, a little bit of the rationale, show you the actual dashboard that we've developed, and then I want a call for help and hopefully collaboration. So let me start this story with the international health regulations. As you know, they entered into force 2005, or adopted 2005, entered into force in 2007, and countries had until 2012 to come into full compliance. Yet when that happened, in 2012, only approximately 22% of countries actually were compliant with the IHR, and 2 years later, when they had their 2-year extension, that number only got to 33%, which meant that 2/3 of the world does not, or at that point in time, did not have the capacity to prevent, detect, and respond to a public health emergency. And which led to a whole bunch of different things. But one of the things that came about was the WHO kind of looking internally and saying, okay, so we need at least a better way to evaluate, to do monitoring and evaluation on how countries are doing. So there is now a four-prong approach that includes annual reporting. So they're looking at it's obligatory, it's self-reporting, it is problematic, but it exists. The second is a series of after-action reviews. Then there are simulation exercises that are done, and then they introduce what's called the Joint External Evaluation, which are external assessments of how countries are doing along 19 different indicators. Okay, so we have that. And since the JEs were released in early 2016, there's been kind of a rapid ramp up of how many countries around the world are actually doing it. They're not perfect by any stretch of the imagination, but they are a tool that are being used to measure how well countries are doing in terms of building their capacity. My last count, there were 75, so this was done a couple of weeks ago. There were only 73, so they're happening, right? But they're still, the majority of the world has not yet done them. And the idea is that you have one of these assessments, and then they're repeated every 5 years. Now, and then the process is that instead of just navel gazing, that once you do an assessment, it then feeds into a larger process where WHO will come in and guide you towards the development of what's called National Action Plan for Health Security. That plan is supposed to be costed and bring in the national level priorities. So you do your JEE, and then you develop a costed plan. The costed part is problematic for most countries. And then you figure out some financing. And that's the idea. And then
costed means you figure out what the cost.
You figure out what the costs are. So we have a tool that we've developed to help countries do that, but that's not what this talk is. But yet that was a stumbling block. So lots of countries were able to do their JE, and then nobody could figure out what their costs were going to be. And then if you can't figure out your costs, it's hard to then develop a plan. And if you don't have a plan, you don't know what your costs are, it's then hard to reach out to donors or even internally to your finance minister and say, we need X amount to build this surveillance system. So that's the backdrop on all of this. And which gets to this key point. It's kind of obvious, but financing is important. You need money. Global health security doesn't happen by itself. And so whether that money is domestic funding or international donors, the money needs to be flowing, which means you need to understand what the funds that are required are and where they're going to come from. So this idea that you have these necessary steps, you figure out what the needs are. So there's the JE process that I just described. There's also something called PVS from the animal health side. There's a couple of other assessment tools that are out there. You then try to figure out what your costs are to address your gaps. Then you define the financing requirements. So the World Bank actually has a financing tool. Then you figure out who's going to fund you and get that money. And then this last piece of understanding who is funding what and where, so you can get a global picture and identify what those gaps are. Now, the other thing that has been going on in this world is that came about when global community realized that countries weren't actually implementing the international health regulations, was the evolution of what's called the Global Health Security Agenda. So this came about in 2014 and is a collection of countries, now up to somewhere in 65-ish, but that's uneven number of countries. It's uneven commitments to this entity. So it's a Global Health Security Agenda, and the idea behind this was also to raise the political agenda of global health security, but also to mobilize resources. And you can see here some of the commitments that were made. The U.S. put $1 billion into investments around the world. South Korea pledged $100 million to support 13 countries. The U.S. commitment was to 17 countries, and then a total of 31, but only 17 get money. And then there have been a whole series of other commitments made by countries around the world, including the G7 commitment to 76 countries, but an unnamed amount of money. So we have this going on. But no one was keeping track. So we decided to jump into this game, but we wanted to do it based on a couple of different principles, and one was on mutual accountability, with the idea that identifying who's funding what should be based on a mutual accountability framework. And this is really best accepted best practices in other areas of global health. We thought it was really important to adopt to a framework for global health security. And we've seen it. There were several other areas of global health that track the flow of money, that use this mutual accountability framework, and that are able to track commitments and actual expenditures, and in an easy to access format with strong data visualization. And we looked at all this, we said, yep, we need to do that in health security as well. So we did. So if you're playing along online, and you have a computer in front of you and you want to play with it as we go, you can go to tracking.ghshosting.org. It works best in Chrome or Firefox. For some reason, we can't get it to work in Explorer very well. So what I want to do is quickly show it to you. And I'll show you the screenshots here because it goes a little bit faster. So what we do is we track on financial resources who is funding. So this is who's funding, who is receiving. We break down, you can look at it entirely, or we also code it by each of the those 19 indicators under the JEEs. So this is looking at who is receiving funds, specifically in antimicrobial resistance. We also track the JEE scores as they're posted on the WHO's website. So you can look at all of them, or you can look at specific scores. So this one would be just for medical countermeasures and personnel deployment. I think I have another one. Oh, this is the scores just for AMR. So yeah, we only post the scores as they are officially reported. So there's a little bit of a lag between the total number that have been conducted and the ones that we're able to post. And then what we've done is we have another metric here where we combine the financial resources and need as defined by the JEE score. So it's a little bit of analysis looking at what their score is versus how much money is flowing into a country for that specific area. So the darker colors here goes to more unmet needs. And the idea then is if you go back to this major map, you pick a country. So here's Sudan. You click on it, this pops up, tells you the high level view of how much money is actually being committed and received by a country. You can also then flip to a donor profile. This is the recipient profile. And then if you click again on that funding profile, this is what pops up. And you get the breakdown by all the funds in the different years, broken down by prevent, detect, and respond. We have another category too, because there's some things like points of entry that don't really come under any of those. And then we list you can actually list who the top funders are, as well as break it down again by those core capacities of the JE. And then if you hover over these parts of the histogram, it pops up who the actual donor is. And then it's the same deal on I pulled up the UK's funder profile. So it's the same thing on the funder side. Again, you see what is being, where they are funding, whether it's under prevent, detect, respond, how much is committed versus actually dispersed. And then again, you can see the overall funding profile and what areas a funder is particularly interested in. And then here, these are the top recipients from the UK. So Afghanistan looks like it's winning there. And then we've also built in a little bit of analytics into the website too. I'm hoping to do a lot more in this, but he just gives you a little sense of what we've built in so far, where you can start to play with looking at who's funding and who's receiving, what some of the patterns are. It's kind of interesting because you can pull up, this is actually just to the Bill and Melinda Gates Foundation, and how many different countries that they are funding. But then you can also look at, we were looking at a country this morning that basically had just one funder. So you can start to see the patterns that are emerging. We also then, in the analytics, you can just start looking at the top funders and top recipients overall. Now, this gets at what comes next. So the first question I always get is, where's the data from? So let me answer that question. So if anybody's curious and being like, that's really nice, what data So right now, this is built primarily using data from IATI, the International Aid Transparency Initiative, that we then coded to the different pieces of health security, which is fine. You get a lot of information. It's pretty good. It doesn't capture everything, and but it was a little bit of like build it and they will come. So let's see if we can actually create the dashboard and then start to analyze that data afterwards. Now, so what we are now doing is a couple of different things. So we have the IATI data that's populated. We are also reaching out directly to funder countries. In part because when I code the data, I'm making a certain set of assumptions. So maybe I'm looking at money that was given for HIV. Is that health? Is the investment in laboratory health security? It might be. It might not be. So I'm making my own value judgment on that. But what I'd rather have, again under the whole mutual accountability framework, is the countries themselves tell me, yeah, I think Canada thinks that the investment in this laboratory is actually building health security, and we would count it under our own country's profile for our funding in this space. So we are now starting to receive data directly from the countries themselves. It's a slow process, but it's starting to flow. Canada is actually one of the first countries we received funding from. The other thing we're doing is we're accessing the publicly available grants databases from the foundations. It's also a little bit of a process, so we're currently cross-checking what Gates has listed versus the Gates funding that's captured in IATI, and it's usually right, but there's a couple of discrepancies, so now working with both entities to figure out what the differences might be. We're also, we've reached out to the World Economic Forum as well as the Private Sector Roundtable for the Global Health Security Agenda, and are working with both of those entities to coordinate private sector information. People are encouraged and want to participate, but right now what we're struggling with a little bit is trying to capture in-kind support. Since that was the first ask from WEF, was like, okay, but our memberships do this, how do we capture that? The other thing that we're changing up is a way to capture funding that goes towards global systems. And so that's some of the stuff we're working on. We're also trying to bring in more analytics and direct access to some of the data, and can talk more about kind of what the future. This is like the beta version. I see something much more robust in the next year. I see the map is just one piece. But here's something I do want to talk about. So if you go to China, and I pull up the funding details, almost nothing comes up. Nothing comes up in funder. Only a teeny bit of information comes up in recipient. And if I pull up, here's the details that do come up. So the 59 million that's come in, which is a really small number, and mostly from Gates, UNICEF, WHO, so UN entities for the most part. But that's not right. So it means that, and this was to your point earlier, and we're not capturing what China is doing for the global system. And even if we're looking at other data sources out there, looking at aid data out of William and Mary, we know the major recipients in general aid. I don't know what it looks like in health. We have a lot of there's a lot of qualitative information, but I've never seen the hard data. So I guess the question here, so the vision, and Matt's giving me I have 1 more minute to speak, but the vision on this tool is not just looking at global funding, but also eventually being able to, very much in the IHME model, can we create a network of collaborators around the world who can help collect data for their country, both outward funding as well as being able to add another level of analysis of what is Nairobi spending in Kenya, and what is national commitments looking like. And so, this is the ask. Anyone interested? It's hard, right? This is really hard stuff, but it might be easier to get good data on what China is spending on China in some of these areas than it might be to get the numbers on what they're spending globally. But we know it exists, so that's my quick plug. And yeah. And then Feng can stand up and say, yes, of course. And wait, 1 second. Here's my last final plug. If you haven't seen this already, go. Global Health Security, Sydney 2019. And 20 minutes ago, I just got an email from the government of Canada that they're also going to be conference partners. So funding is starting to roll in, and as I mentioned earlier this morning, the more money we get, the more people from low, middle-income countries we can pay to get there. So it's looking good. So this, every time I stand up now for the next year, I have to give a plug for the conference. All right, thanks.
I'm the last one, right?
You're the last one.
Okay.
Because you're going to give us all the answers.
You gotta solve everything
trying.
all at once.
I tried. So Rebecca already mentioned the China data. I think China already spent all the money on the health security domestically, like the whole infrastructure about the CDC system. So the Michael just shared with us, and also China spent all the money in the other countries, and the Matt mentioned that, if I get your question clearly, why is China from the donor recipient to the aid recipient to aid donor, and then how the China donation and development money will change the global landscape. So actually today my topic is the new development agencies, and this means we are from aid recipient to the aid donor. And the second is how the new agencies will influence the traditional global development system. So this is my questions on the future of the China aid. So I try to address your two questions. Yeah. Okay. In the China, the one thing is I think it's good news for the global development world. So you have additional force to the global development. And the second point I want to mention is China also the traditionally our aid not very coordinating very well. It's we have problem of the fragmentation. So now we tried. This is the one purpose to set up this new agency. So maybe next few minutes I'll talk about three things. Why the name of the new agencies is State International Development Cooperation Agency. It's not official translation. We don't have the official English name yet, because the agencies is less than 1 month old. Very new organization.
What's the Chinese name?
国家国际发展援助署. Okay. And then share some question and thinking about how the China aid will look like in the future. And then give you some example. So this is the China South to South Cooperation Assistance Fund. Okay, so this agencies is announced in the fourth plenary meeting of the first session of the 13th National People's Congress at Great Hall on March 13th. Very new. And actually inaugurated in the April 18th. So today is the 14th, right? The May 14th, last month. So actually attended by two important people. One is Yang Jiechi and Wang Yi, okay, the foreign minister and the previous foreign minister. So in this organization, the 5 basic responsibilities. So it's the first one is drafting the strategic guidelines and the big plan, the blueprint, and the policies for China foreign aid. And the second one is the coordinating major issues for the foreign aid and provide some recommendations. So China say we have some issues, you know, like we have some competition between the foreign affairs and the Ministry of Commerce. So everybody know it. It's not secret. So and also we have planned to reform China aid system and design the program and make plans and also decide the program and oversee the implementation, like monitoring and evaluation. So but actually the concrete project will be undertaken by relevant ministries. I will give you some more explanation. And this ministry, this agency will report directly to the State Council. So it's an independent agency, government administration office. And also, not long ago, less than 1 month, we have the chief and the deputy chief of the agency. The chief is the Wang Xiaotao. It's the Vice Minister's Network, and previously is the Vice Chair of the National Development and Reform Commission. So it's very strong commission. Everybody understand the Chinese system. So NDRC is so-called Little State Council. So very powerful government organization. So Mr. Wang have the extensive experience in the policy and the management. So this is why brought him to as a director. And he's a Tsinghua alumni, most important to point out. and the deputy chief is the previous Department Director General of the MOFCOM, is the foreign investment, in charge of the foreign investment and economic cooperation. And also before the commerce, the Minister of Commerce, he have worked in the Zhejiang province for many years. And the second deputy chief is previously the Director General of the Ministry of Foreign Affairs. And also he was the ambassador in 2 countries in Africa. And he is medical doctor. So from my medical school, Tongji. so it's the health development. It actually 1 year before me that we know each other. So that we think the health will be important piece, hope, within the foreign aid in China in the future. So question 1. So what the Chinese new agents, aid agents, development agents will look like. So we have to understand what the mission. So this is the USID's mission. I'm not giving the one by one word, but I just the headline, some important word, the key word. One is the democratic values, right? Freedom. And the American foreign aid policy is along with this. And the partnership in the investment, right? You can say it very quickly. And then the second one is the AFD. It's French Assisted Development Agency. How to pronounce? Agence Française de Développement. So AFD. So they said that there is foreign France overseas development assistance policy. They have their own policy, and that they want to protect global public goals for all home means. So that's their mission. And the JICA, so our neighboring countries. So they also have development cooperating charter, and they focus on the human security and the quality growth. So what about China, the foreign development agencies? I think two things are important. So one is the community of the common destination, a shared home for humanities, and proposed by President Xi Jinping in the UN mission. So this is broad China foreign policy. So over 8. I just my own analysis, okay? So not we don't have a mission yet. So And also, I think in the short and mid-term, the Belt and Road Initiative must be the concrete piece, because we share the value of the co-building, co-sharing, and the win-win cooperation. So these two parts will become very important piece and the keywords in the future. They didn't ask me for advice as well. I just don't know the lessons. Okay, so I think China 8 were not much difference from other countries. But the second question is, what is the real national interest of China? Is commercial driven or diplomatic and political driven? So my second question is, so how to balance and weight the commercial interest and the political interest of China 8? So the foreign aid is official development assistance with commercial and or political and diplomatic interest. That is my understanding. So development for sure. Everybody say we do development job. But the two important angle to have more analysis. One is the political, like diplomatic, and otherwise commercial purpose. So if you look at it very briefly, the U.S. is very political and diplomatic and State Department right now. So it's a sort of power. And Japan is very commercial for many, many years. Every Japanese aid with the Toyota donation, right? The refrigerators donation for the cold chain worldwide. But now that changed a little bit to more diplomatic, less than commercial goals. If you look at France, they're very political, human rights, everything. And Germany is combination of the commercial and the diplomatic. But in China, before the 80s, we've seen the China medical team to Africa. So it's really political purpose. China want African folks for us to come back to the United Nations and remove Taiwan out from UN. So that is very political. And after China opened the door policy during the Deng Xiaoping's period, and it's really purely commercial driven. So that is why traditionally in China, the China foreign aid is on the Ministry of Commerce. It's not on the Ministry of the Foreign Affairs, it's Ministry of Commerce. But right now, in the future, I think we will have strong diplomatic interest, maybe mixed with some commercial goods. You say, because if you look at the opening, the picture I just showed you previously, so the agency opening ceremony attended by the Yang Jiechi. Yang Jiechi is director of the foreign affairs on the party, on the CPP, and the previous state councilors and previous foreign minister. And Wang Yi is current foreign minister and state councilor. State councilor equal to vice premier. So that means in the future, this office may have to report or consultate with foreign affairs part. So I think in the future, near future, the diplomatic interest will play the major role than commercial purpose. So that's my second question. And the third question is about the transparency. So data. So because if you look, I just give you an example. The funding level, the China and the U.S. provide roughly same level of funding, like $100 billion to Africa between the 2010, 2013. So that's from 8 data. But the recent year, we invest more in Africa, according to Matt. Matt just mentioned, yeah, that's true, because Deborah also have reached the new book where African fit China. They also discuss a lot of this kind of things. So actually, China investment in Africa is 4 times the United States. But also there's some wrong understanding. Because people think China inward to Africa is for the resources, right? Everybody think resource. No, the biggest the investment in Africa in the whole year is United States, and the biggest of the investment in Africa on the mining is Canada. China actually is not. It's the other small business, agriculture and other field. So and traditionally China have their own ways handling foreign aid, like the 9 different kind of the foreign aid, like grants, interest-free loan, and the concession loan, and the projects, goods. But also, if you talk about the transparency, as you don't have all data, because we're not opt out from the international aid transparency initiatives. So we don't have data there. Because when we talk about in the UN, we think we are developing countries. We are not the ODEC countries. After set up the new agencies, something may change. Because now that's officially recognized or served as the aid donor. But we never officially recognize or serve as the aid donor, even we already did a lot of the foreign aid business. So, but the data is currently available than previous decade. So, and some efforts increasing the transparency in the Beijing. That also is an argument. So that is the whole reason set up the new agencies. Actually, when Jennifer asked me to talk about this topic, I have more questions, but I think I cannot remember more than 3. So I keep I keep 3 questions. And the final slide is a very practical one. So that recently we have the China South-to-South Cooperation Assistance Fund. So that is supporting other developing countries to achieve the SDG. And the budget is about $2 billion US dollars. So currently, is on the both count still. And the Chinese organization, international organization, social organization, foreign organization can apply, not only Chinese. And the foreign aid cooperation and encourage foreign aid and like a bilateral and 3 parties collaboration and the private-public partnership. So, but the request, the potential implementators have the track record and local partners in the receiving countries. But just also before the Chinese May 1st neighbor holiday, so the first call for the concept load out. And by the next month, the 11th June, so it's deadline for submit the concept load. We never do this before. We just assign, you do this, you do this. You're going to Sudan, but this one is bidding, open bidding. But you have to pass the qualification check first. So that the health and the medicine is one of the 7 areas. And this year, for the health, they have 4 priorities. One is the improving coverage of basic health service. And the second one is strengthening the prevention and the control of infectious disease, and maternal health, children's health, and the nutrition. And the size of each project came from the 100,000 to $2 million US dollars. So even one conference or one project is okay. But organizations that's already selected, you have to check your background. The Tsinghua, our center, actually the name of center, and the Tsinghua University, and the Peking University, around 10 universities selected to bid this first grant. Okay, thank you.